Hi everyone. I'm here today to talk to you a little bit about what it's like to be a nurse scientist. My name's Breanna Hetland, and I'm an assistant professor at the University of Nebraska Medical Center College of Nursing, and I also serve as a critical care nurse scientist for the critical care division at Nebraska Medicine. So I'm going to first start with my interest in nursing and how that came about. I'll be really honest. I think that this picture is an accurate description of me at 18 years old, trying to figure out what I wanted to do with my life. I knew I wanted to be in some aspect of healthcare, but in my junior year of high school, my mind was all over the place. I was going to go to vet school. I was going to go to med school. I had thought a little bit about nursing, but honestly wasn't sold. My real focus at the time was on med school. So I like this next quote because it says, "Luck is what happens when preparation meets opportunity." If any of you can relate, wondering, what am I supposed to do with my life? I think that the best advice I can give you is create and take advantage of as many opportunities as you can to figure that out for yourself. So let me give you an example. When I was a junior in high school, I really thought I wanted to go into medicine. So I went door to door fundraising money to pay for myself to go to a program at Tulane University that was specifically for high school students exploring medical programs. Now, I literally went door to door in my neighborhood trying to get enough money to pay my way. There's no fun in that other than just meeting cool neighbors, but that's not really what you want to be doing at 17. But I took advantage of an opportunity that I had, and I worked really hard to prepare for that so that I could go on this trip. So I raised enough money and I got to go, and it was 2 weeks at Tulane University learning all about medicine. It just so happens that one of the days that I was there, I accidentally ended up in a wrong lecture, essentially. And I was in the lecture that was an introduction to nursing. And I left that 2-hour session and I loved it. And I went home shortly after and I told my parents, I don't know that I want to go to medicine. I think nursing might be a better fit. So fast forward a few months later, and I had taken my first ACT. Did okay, but not super great, not good enough to get a scholarship. Luckily, I'd had a advisor at a school I was looking at say that if I could just retake it and increase my score a little bit, that I would have the opportunity to be eligible for a scholarship. I worked my tail off studying for that. Ultimately retook it, increased my score by 4 points. To make a very long story short, got a full ride to a college that didn't have a medical program. They only had a nursing program. So sometimes taking advantage of a lot of opportunities and preparing yourself and working hard will help the stars align for you. So ultimately, I ended up in a great program at a great college doing something I love, which is nursing. So I just put a couple pictures up here for you to kind of help you relate to where I'm at now and where I came from. So I went to a small grade school. It was a K through 8 in the middle of nowhere, Illinois, in between the corn and the bean fields. I think in my class, there were maybe 40 kids, 45 kids in my 8th grade class. I went to a larger high school as a conglomerate of a lot of communities that come together, and ended up top 10 in my class in 2006. So please don't do the math and realize how old I am, but it has been a while since I've been in the high school setting. Certainly was a great experience for me. I had a lot of wonderful teachers and mentors that helped me get to that top 10 photo you'll see at the bottom. So after graduating high school, I moved to Southern Illinois University in Edwardsville to pursue my degree in nursing. I graduated in 2010 from that program and immediately started working back home in a critical care unit. From there, after about probably 2 or 3 months of being on the floor, working night shift, I realized quickly that I really wanted to go back to school. I loved bedside nursing. It was hard. I give high fives to all of the nurses I work with. over at Nebraska Medicine, because it is so hard. Such a rewarding career, but something I knew that I didn't necessarily want to do long term. And at the time, I was living at home with my parents, and it was a great time to just, go off on my own and pursue another step of my education. So I had a mentor in undergrad who had mentioned a BSN to PhD opportunity in that type of program. And I had no idea what that meant. And at the time, I didn't want to go back to school. I just wanted to start working. And anyways, that planted the seed in my head that maybe I should pursue a PhD. So I ended up getting into a program at the University of Minnesota, specifically to work with a mentor there who was an expert in integrative health and healing in the ICU. So I was there pursuing my PhD from 2011 to 2015. At that point, I moved out to the Cleveland Clinic, Case Western Reserve, University Hospitals, big research education conglomerate, and I finished a postdoctoral fellowship in nursing research in 2017. So at that point, when I finished my fellowship, I made the cross-country move, and we have been here in Omaha ever since. I'm just going to give you a quick review of my clinical experiences, because I think clinical is a very important part of informing research and what I do now. So I had really gotten my first bedside experience as an extern. In 2009, I moved to Rochester, Minnesota as part of their Summer 3 externship program. And I spent the summer just absolutely, totally engaged in clinical care in the transplant ICU. We got to take classes, we got to work at the bedside. It was a really, really rich experience. After graduation, I moved back home to Peoria, Illinois, and started a job in the medical ICU at Unity Point Health. Worked night shift there for approximately a year before pursuing my PhD in Minnesota, in which case I took a job in the medical ICU at the University of Minnesota Medical Center. I put this photo at the bottom because it is very important to me. This was a big day in my life. May 13th, 2015. My spouse picked me up, brought me lemon heads and flowers for a celebration of my last day at the bedside. I loved bedside nursing. I loved the people I worked with, the ICU patients and families, but it was time for me to close that chapter so that I could further pursue my research. I included a slide here titled All Work and Some Play. I thought this would be kind of fun for you to see some photos of this education and work experience that I had. So I'm really fond of some of these memories. At the Mayo Clinic, there's me in my scrubs working a night shift with a colleague. At the bottom, I have a photo of me and my dog Buddy, who was a therapy dog. We did a ton of training together so that we could volunteer in a variety of pediatric and adult ICUs throughout the country. And then lastly, I got a wonderful opportunity to study abroad for a semester. And so here's a picture of me in a Tibetan pharmacy. I spent a whole summer in China and Tibet studying integrative health and healing. So talk a little bit about my interest in nursing research specifically. To be perfectly transparent with you, I didn't ever want to do research as an undergrad. I wanted to work clinical. I was sure that that's where I was going to stay. I just happened to get a great opportunity as a senior nursing student to participate in an undergraduate honors seminar. And part of that entailed a stipend for me to take some extra classes and then conduct my very own research project. And like I said, I didn't have a lot of interest in research at all. It wasn't even one of my top 5 classes. I didn't love research. But after getting this experience and being able to do my own work, I realized that there definitely was something there that I loved, and kind of planted the seed for me going forward. So my research, in technical terms, I have quoted it here, is to improve the patient and family experience with critical illness by engaging patients and their family caregivers in integrative therapies for the self-management of distressing symptoms in the intensive care unit. That's a whole lot of words. What I'm really aiming to do with every day of my life at work is to bring humanity back to an often inhumane ICU experience. So the way I conceptualize doing that, my work takes technology and technological interventions. I combine it with this lens of holistic health and healing, with my ultimate goal to make people and their families whole again after critical illness. So, a couple of different things that I currently have going. I build mobile apps. So, my current clinical trial is using a mobile app that my team developed to ultimately help family caregivers who are visiting the bedside assess symptoms, treat symptoms with a whole list of integrative therapies that we teach them, and then to chart those things that they do at the bedside for the patient. So this is happening currently in the Warner ICU at the Buffett Cancer Center here in Omaha. And we deliver the app via some tablets that the hospital hands out to every patient and family that comes through. So this is a great project. I've learned a tremendous amount along the way. It is not easy to build technology, and it is certainly not easy to integrate it into a large health system. There's a whole bunch of privacy things we have to work through and data storage. So I get the blessed opportunity of getting to work with IT professionals and providers and kind of bringing it all together to hopefully help patients and families through this experience. So this is just a quick snapshot of what the app looks like now. You can see there's 3 circles towards the bottom of that screen. Those are educational modules where we give people a virtual introduction to the ICU. We teach them about symptoms of ventilated patients. And then, like I mentioned, we teach them things that they can do to help that patient feel better and reduce their symptoms. So we also provide families with what we call a care kit, and that is full of all of the tools that they might need to do things like acupressure, aromatherapy, massage, music therapy, etc. Then we have this guided help and fast track buttons where families go in and they actually chart what they're doing. This is a very important piece of this because ultimately then we as providers can see what families are doing and charting at the bedside. So my second clinical trial is a great fun experience for me. We use pet therapy in the pediatric ICU for physical therapy and occupational therapies. The catch here is that we use a robot instead of a live animal. Live animals are awesome. I'm a pet lover. In a princess world, I would bring all the animals to the ICU and we'd be good to go. But there's some infection risks and concerns there. Obviously, live animals are bigger. It's hard to move around the lines and the tubes. And ultimately, you have an animal that may be well trained, but we can't completely control and could pose risk to the patient. So we use a robot. Super fun. This is Paro. We have another one named Pickles, and we bring them in and work side by side with occupational and physical therapists, and it's a great time. I've included a news story here, a link if you guys would like to go there and see a story we recently did about Paro in the ICU. And also, if you're interested, please do go to Instagram and follow @therapy.seal. And you can follow Paro and Pickles around in their adventures throughout the hospital. So my future plans, kind of 2 goals here that I want to continue to pursue in the future. First one is inspiring and training the next generation of brilliant nurse scientists. I've included here a photo of my 1.5-year-old who recently has taken up a stethoscope. Mind you, she has it on the dog's head, and she also doesn't have the earpieces in, so we still have a lot to work on. But ultimately, I do want to inspire other nurses to pursue their dreams. And if nursing is that dream, I want to help them through that process. And secondly, I want to be the voice for the 4 million critical care patients and their family caregivers that endure the ICU every year. With COVID-19, this is only going to be an expounding problem, and I want to be a part of the solution. So I included a picture here with one of my most cherished family members of an ICU patient I've ever taken care of. With Bob's permission, I've shared this picture with you all today, but He recently passed away, but for the last 8 years, Bob and I stayed connected. I took care of his wife for the last 3 months of her life and got very close to him and his family and had the blessed experience of even speaking at her funeral. So to make a lot of great memories together with Bob. I'd go home and have coffee with him at least once a year. And so this is something that's personal to me. I want to be the solution or part of the solution for these families and these patients who have to endure critical illness, which is really tough and has a lot of complex side effects that can last for a long time. So I wanted to share with you why I think being a nurse scientist is seriously the world's best job. And I'm going to do it through storytelling because I think that's the most effective way. So I put some titles up above these pictures, but this is why I love my job. First and foremost, the opportunity for professional development. Every day is different in my job. I'm constantly learning. I'm able to learn teaching skills, and I go to seminars about how I can improve my research skills, and I learn a lot about how just to be a good professional and a good steward of intellect and sharing that with the community. And so I really love that aspect of just being able to engross myself in constantly improving and hopefully improving outcomes for patients subsequently. Secondly, I get to travel a lot. This is a picture of me and my family. We went to Banff, which is in Calgary, last year to present at a conference. And so I decided, why not just all go together? And we made a huge family trip out of it and had a blast. Layla had to get a passport, which is funny, taking a 6-month-old to the passport office, but it was great. And this is an aspect of my job that I do really love. It's autonomous. I get to make my own schedule. I mentioned previously, every day is different. I love that. I get to use my mind and my own thoughts and creativity to come up with solutions for people, and then I get to evaluate it to see if it works. And so just kind of being in charge and being your own boss in that process is great. My connection with patients. This is another picture of a breakfast date that I went on with Bob several years ago. And so, I never lose sight of these patients, and I often will round with the ICU team just simply to get to meet people and kind of stay connected to the clinical setting. Financially, this is a great job. It offers me a ton of flexibility with a salary that allows me a lifestyle that I really do love. And so this is a picture of my kitchen in our house here in Omaha. It was the first home that we've ever purchased, and that was a big step for us. So I do think that the financial benefits of this role definitely are worth making mention of. And lastly, just the overall lifestyle. Because it's autonomous, because I make my own schedule, I get to also balance my work and my life and my family and my hobbies all together. I'm an avid CrossFitter. I go to CrossFit 3 days a week, never miss a class. Layla goes to daycare, but she's only there typically from 8:30 to 3:30, which means that my husband and I get plenty of time to hang with her and really just play and be able to be present in that aspect of life too. I never miss a doctor's appointment, never miss an activity at daycare. And so being able to have this job that I love, but also have a life outside of this job that is fun for me is a huge deal. So how do you know if research might be a good fit for you? I put a couple bullets here, and this is what I share with undergrad students in our program. Some things that might start to get you to think that a PhD and research might be for you. Are you a why person? Are you someone that goes into a situation and says, this is great, but can we do it better? Or why do we do it this way? I think that's a token of all researchers. Has anyone ever told you that you overanalyze things? My husband loves me dearly, but often mentions, Bree, can you please just let that go? Like, why are you analyzing that? Why? And I can't help it. It's just who I am. And so I tend to be a really pragmatic, analytical thinker. And so that has served me well in this job. Do you frequently have flight of ideas? In undergrad, I could remember listening to lecture and I'd be so into it that I'd have to take notes about, like, I'm going to look this up later, or I'm going to check this out on Google, and just really trying to constantly take what I was learning and then come up with the next step. I love this one. Do you ever geek out in class? I sometimes would be sitting in class and everyone else seemed kind of bored and I'm on the edge of my seat and taking notes, or I'd, ask a question and people like, really? You're this interested in that? And it was a variety of topics. It wasn't just nursing. And so I think if you're constantly someone who's sort of striving to push the envelope a little bit, to ask the questions, that this could be the right career for you. And lastly, do any of the following describe you? A leader, self-motivated, strong work ethic, effective time management. These are all skills that are critical to being successful in this capacity. So with that, I'll close my presentation, and we'll offer the opportunity, if you have any further questions or just want to chat again, please do reach out to me via email. You can find my email address on the College of Nursing website, but I'm more than happy to sit down and chat with anybody who might want to learn more or dig a little deeper into the PhD as a profession. So thank you so much for listening, and I wish you all well.